We are here with Dr. Buter and Otto to talk about cat behavior. So, Dr. Buter, is it possible to fix behavior issues in a cat?
It is possible. Cat behavior issues can be very sneaky and oftentimes can be shown in ways that we don't necessarily think of as stressful or wrong or causing issue. So they have to be pinpointed to be able to change those behaviors. But you always want to try and catch them quick too, because they always get imprinted where they get that behavior going in their brain, and then sometimes it's hard to reverse those.
So, what are some signs and symptoms that maybe Otto here would have if he had behavior problems?
A lot of cats will show their stress and anxiety by litter box changes. So urinating outside of the litter box is very common, or having bowel movements outside of that litter box. A lot of them will also do something called barbering, where they start to chew or pull their hair out, whether it be on their arms, their tail area, or their belly. They can also overgroom in general, where they just constantly sit there and clean themselves and never take a break.
When do you think it would be a good time to take my cat into the vet when behaviors are arising and just to discuss behavior?
Really anything that is out of the ordinary for your cat. So if your cat has never really been a vocal cat, if they've been a quiet cat and all of a sudden they're doing a lot of talking, that can indicate that they're having a behavior change for a reason. Same thing, if they're usually really vocal and then all of a sudden they become very hidey and independent, that as well. Or like I mentioned, like the barbering, anything that you're noticing that's out of their normal routine for them, the sooner the better as far as getting it checked out and trying to come up with a solution.
And how would you diagnose behavior problems in Otto?
Honestly, it's a lot of the history. So when owners say, they're being more hidey or they're being more loving or more vocal or going outside the box, or barbering, we do a physical exam to try and indicate, is there an area of pain? Is there an area of deficiency that they're developing? Like maybe their eyesight's changing, or maybe they're having headaches from high blood pressure, or bladder pain from a UTI. So doing an exam and putting those pieces together with the history kind of helped to figure out what's the matter.
What are some possible health concerns that can arise from cat behavior problems?
Usually cats get this very strange symptom or disease process called Pandora syndrome. And it's where the body actually produces inflammation in the bladder wall because of stress or behavior change. We don't really understand it. We don't know how they can do this, but they will start to inappropriately urinate in multiple places and not use the box at all. So that really is a hindrance. One, to them, it's uncomfortable, but that really does hinder the human-animal bond because nobody likes cat pee all over their house. That's the most common problem as far as an actual true, medically potentially managed problem. The rest is more, well, they're barbering. As long as they're not creating skin sores, they just don't have hair.